So originally when I came in to Dr. Khan, my hair was very thin from the top, and with his guidance, he told I had lots of medically approved treatments for hair, just to strengthen the hair I already had, to thicken it up. And over the course of 2 years, I saw like a big difference in hair strength and hair width, and like other factors like shine as well. But and around after 2 years of treatment, we did a hair transplant where they filled in the hairs on the spots where the hair follicle did not grow anymore. And overall, the experience was lengthy, but in the end, the results I think will be worth it.
Hi, today we are going to talk about how to deal with the hair loss for the younger people. Mother came to me around age 19 and he was thinning and very thin look. Like it was very strange how somebody so young could be like so much thin and have so much hair loss. At that time we decided number one most important thing is to strengthen his hair, and there are phenomenal FDA approved medicines which help people not to lose hair and make the existing hair stronger and thicker. And that treatment at least should be there for 1 or 2 years. So what we did, almost give the mother treatments for 2 years, and these 2 years has dramatically changed mother appearance for better. And after that we did add up, but if there is no hair in certain areas, then there is no hair is going to grow with any medicine. In those empty areas, yes, we add up some hairs. So as every situation is different, mother was more challenging. If somebody is older, they don't lose hair very fast, we don't have to go the medicine route for that. We could just do the transplant, fill the empty gaps and make a beautiful hairlines in those situations. But in mother's situation, what was more important? To strengthen the existing hair, not to lose any more. So that's what we did. So for mother, yes, we did almost 2 years of medical treatments, which really helped the mother to get in a baseline where he was already looking so good. And then where there was empty spaces, and we found those empty spaces and we just did the transplant. And for that we needed 5,000 grafts, we did in 1 day. And yes, no, he's only 21. We never did any temple because temples could recede for younger people. But when we restore the hairline, the most important is that it should look good even today and even at age 90. So we don't do hairlines according to the age. It doesn't matter what age he is in. We do hairline which proportionately matches his face, because everybody has a unique features. It should enhance those features rather than just doing because he's young or he's old, that kind of old hairline. No, there's no young or old hairline. It should be according to the face. So what we learned from mother, so how much he got help, but we need to get out to seek the help from good people. And in this business, like always go for board certified hair restoration specialists, are those people who are like certified in this area. But because there are really good medicines which help you not to lose the hair and also make the existing hair much stronger. And that's what happened with mother. And mother took those medicines only for 2 years, and all his hairs, which were so tiny, if I would have done the procedure or transplant at that time, what would have happened? Those tiny hairs could not sustain the trauma of the procedure and they might have fallen. So why to take those kind of chances? Why not strengthen the existing hair first and make the situation better, and then you could move. What are the empty gaps? There's no hair, of course there's no hair is going to grow because of the medicine. But what does happen? Mother really in 2 years improved a lot. And then after that what we did, we just did a transplant, almost like 5,000 grafts, and these are like very tiny, and mother could go back to work very next day. We do it in a little different way. We put the same length hair. That allows to determine how the hairline should look at even at the very first day. This is mother's second day, and mother is very comfortable. He's resuming his work and everything is back to normal except one thing. He's in a very good shape, so he could not work out at least for a week. That's all. After that, he could do anything, but he could go to regular business every single day. I'm very happy and very much looking forward. Mother is going to be happy for the rest of life. Thank you so much.